Good evening, good evening, good evening. Let us ring the bell and get started with reading tonight's Reparations AB 3121 final report. Tonight, I want to dedicate this show to my children, Kali and Nijavan, and to Dr. Tella Pragada for making a 29-week baby a reality, and for Dr. Ho for making a full-term baby possible. So with that, greetings and good evening, beloved people. Thank you so much for joining the Coalition for a Just and Equitable California this evening. Hope you're having a fantastic day and week. Welcome to our live weekly YouTube reading of the final report of the California Reparations Task Force right here on the CJEC YouTube channel. This is the only live reading of the California Reparations Task Force's final report on YouTube. The final report of the first in-nation California Reparations Task Force is one of, if not the most important government reports about the Black American community since the 1960s. Equally important is also the foundation for current and future reparations legislation in California. The report is nearly 1,100 pages long, and we're bringing every page of it to you chapter by chapter every week on Thursdays at 7 p.m. so that you are properly educated in your advocacy for reparations in California. Today's reading of the final report is presented to you as a community service with support from the reparations organizing and mobilizing team at the Coalition for a Just and Equitable California. CJEC is California's leading grassroots organization born for reparations and reparative justice for Black American freedmen living in California. For more information on CJEC and our work helping to enact the law that created the California Reparations Task Force, California's law requiring state agencies to collect data on descendants of U.S. slavery, the Act to End Current Slavery in California State Prisons, the California Freedmen Affairs Bill, and more, visit www.cjec-official.org. Before we go any further, right now, I need you to do three things. First, connect to our YouTube channel by 1, liking this video, 2, hitting the bell for reminders, and 3, subscribing to our YouTube channel. Second, get connected to us on social media by following CJEC on Instagram, TikTok, Facebook, and Twitter at CJEC Official. Finally, get informed and involved. To do that, visit www.cjecofficial.org to sign up for current and accurate California reparations news and info on our Get Involved page. And support our work by volunteering and or donating. To donate, just click the donate tab on the homepage of our website. Special thanks to our amazing fiscal sponsor, the California Black Women's Health Project. You can learn more about our fiscal sponsor, the California Black Women's Health Project, at www.cabwhp.org. And by way of introduction, I am Friday Jones, Khansa Jones Muhammad. I live in Los Angeles. I'm from Do or Die Bed-Stuy, and I'm a volunteer reparations advocate with CJEC's Reparations Organizing and Mobilizing team. The agenda for today is Chapter 29, Policies Addressing Mental Health and Physical Harm and Neglect, of the final report of the California Reparations Task Force. You can follow along in the reading, download tonight's chapter, or the full final report yourself by going to our website, which is www.cjecofficial.org reports. Okay, we're about to start our reading, but before we do, I have some special thanks and announcements. First, as always, I'd like to thank our good friends at ETM Media. Kim is holding us down tonight on YouTube for their live readings of the first California Reparations Report. You can watch their readings of the first report on their channel at ETM Media Group on YouTube and on our website at www.cjecofficial.org/videos. Second, for those of you who don't know, historic reparations legislation in California is here and more is coming. SB 490 is California's first lineage-based reparations-related legislation to establish the California American Freedmen Affairs Agency. This bill was introduced by State Senator Stephen Bradford and will move forward this year, 2024. To read the bill, visit www.cjec-official.org/advocacy. Third, as mentioned, more historic reparations bills are coming. Over the next several months, more reparations bills will be written. During the 2024 legislative session, we'll see more of those bills introduced and start moving forward, passage by majorities of both California's State Assembly and Senate. And to pass reparations bills this year, we need 41 Assembly members and 21 senators to say yes. When those bills are passed, we need our governor to sign the bills. So to make reparations a reality in California, the math is 41 plus 21 plus 1. That's 41 assembly members, 21 senators, and 1 governor. 41 plus 21 plus 1 equals reparations in California. Lastly, but not least, special thanks to CJEC's reparations organizing and mobilization team, and specifically our volunteer final report readers. And without any further ado, we're going to hop into Chapter 29 of the California Reparations Task Force Report, Policies Addressing Mental and Physical Harm and Neglect. And we're going to pick up on page 799. Let's go. In this section, remedy disparities in oral health care. Oral health is closely linked to chronic diseases such as stroke, heart disease, and diabetes. According to the U.S. Centers for Disease Control and Prevention, the CDC, most dental diseases are preventable. Yet children still suffer from dental disease due to inadequate home care and lack of access to dental services. Poor oral health has been linked to decreased school performance, poor social relationships, and less success later in life. As in other areas of health, African Americans disproportionately suffer from these harms. Recent data confirm that, quote, there are persistent and significant disparities in tooth decay experienced and untreated tooth decay between non-Hispanic Black and non-Hispanic white populations, end quote. The data also shows that there are significant racial disparities in the prevalence of periodontal disease, severe periodontitis, and tooth loss, as well as oral and oropharyngeal cancer survival rates. Studies have also found that structural racism contributes to oral health disparities. For example, studies have found that Black populations have poorer access to preventative services, dentist treatment decisions are affected by implicit bias, treatment recommendations favored extractions versus root canal treatments for Black patients, and there is a substantial underrepresentation of Black dentists in dental profession and workforce. The findings of these studies dovetail with what experts have identified as barriers to oral health care for African Americans. 1, a shortage of Black dentists. 2, a shortage of Black dental students. 3, a lack of dentists in communities of color. 4, implicit bias among dental care providers. And 5, affordability and access to insurance coverage. Another study confirms that insurance coverage, treatment costs, and access to care influence oral health disparities among African American men. Four solutions to improve oral health care emerged from a recent survey of African American seniors. These solutions include 1, better oral health care education starting at a younger age. 2, free or at least affordable reduced cost dental care and vouchers for dental work. 3, provision of on-site community dental services, and 4, navigators to help educate community members about insurance payment options and available low-cost providers. Survey respondents also suggested incorporating more dental education in schools through pamphlets for kids and parents, and having dental professionals visit senior centers to provide services and education. Additionally, the CDC has identified that school sealant programs are effective in preventing cavities in millions of children. Specifically, school sealant programs involve providing pit and fissure sealants to children ages 6 to 11 or in grades 1 to 5. The programs also include licensed dental professionals screening children for oral disease and checking whether they already have sealants. This is done via signed permission slips from parents and guardians for dental sealants to be applied, typically at no cost. The CDC noted that states can assist by 1, quote, targeting school-based sealant programs to the areas of greatest need, end quote. 2, quote, tracking the number of schools and children participating in sealant programs, end quote. 3, quote, implementing policies that deliver school-based sealant programs in most cost-effective manner, quote, end quote. And 4, quote, helping schools connect to Medicaid and Children's Health Insurance programs, CHIP, local health department clinics, community health centers, and dental providers in community to encourage more use of sealants and reimbursement of service. The task force recommends that legislature establish and fund a program like UC Prime for University of California and California State University dental programs to be focused on working with and providing oral health care in African American communities. The task force also recommends that the legislature add the completion of an anti-bias training and an assessment based on such training to the graduation requirements of all dental schools in California receiving state funding, and to the requirements for licensure by the Dental Board of California for licensed dentists and registered dental assistants. We are now on page 800 and continuing. The task force recommends, in conjunction with its recommendation to establish and fund community wellness centers in African American communities, to deliver services in a manner that is culturally congruent with African American culture, that the healthcare advocates staffing these centers also help their clients navigate insurance payment options and find low-cost providers. The task force also recommends that the legislature implement school sealant programs in California elementary schools, which will also include oral health education. Finally, the task force recommends that the legislature fund oral health care to underserved populations in the African American community, including seniors, by authorizing state funding for mobile dental clinics, preferably within trusted community-based organizations, which may be achieved through a state-funded grant-making program. Next section. Fix racially biased algorithms and medical artificial intelligence in healthcare. Researchers have established that there is evidence of significant racial bias in a widely used commercial algorithm developed by health services company Optum to guide decisions in the United States healthcare system. Specifically, researchers noted that bias occurs in this algorithm because it used health cost as a proxy for health needs. Because less money is spent on Black patients who have the same level of needs as white patients, the algorithm incorrectly assumed that Black patients are healthier than equally sick white patients. Accordingly, Black patients had to be much more sicker than white patients in order to be recommended for the same care. Optum has replicated the study with the same researchers and saw an 84% reduction in bias with a new algorithm that uses health prediction in conjunction with cost. Despite this change, racial bias has been found in other medical technology. An ACLU paper provides 4 examples of racial bias in medical artificial intelligence, AI, medical devices, and algorithmic decision-making tools, which include, let's go, 1, an AI tool meant to decide how to best distribute the limited resources of extra care to new mothers at risk of postpartum depression was found to show racial bias, directing care away from Black mothers and favoring white mothers. 2, a widely used clinical algorithm indicating kidney health is adjusted based on whether a patient is Black and systematically indicates Black patients are healthier than they may actually be. In fact, an October 2020 study found that without this explicit race-based adjustment, nearly a third of Black patients would be reclassified as having more severe kidney disease. Only in September 2021, after increased pressure from lawmakers and advocates, was the algorithm updated to remove the use of race. Still, recent reports suggest the old algorithm is still being used by federal courts to make determinations about health-based early prison release, despite litigation indicating that it functions in a clearly biased way. 3, a recent meta-analysis found the vast majority of machine learning ML studies in dermatology did not include information on different skin tones as part of the algorithm development. As a result, the validity of model results varied based on skin tone, with some models performing worse on darker skin. And 4, a 2020 study on pulse oximeters, a medical device used especially in COVID-19 pandemic to monitor patients' oxygen levels, detailed that the devices are less accurate among patients with darker skin and could even increase risk of adverse health outcomes for those patients. In fact, a 2022 retrospective study confirmed that patients of color, likely due to this known bias, received less supplemental oxygen than white patients, contributing to their morbidity. While this is a hardware issue, it shows an existing bias associated with patients' skin color in medical devices. Instances like this are alarming, considering that this issue was arguably more predictable than issues that may arise from the use of AI as a medical device. Bias in commercial algorithms can have harmful effects on African American patients at all points in the healthcare process, from the triaging of illness to the quality of care received. The algorithms also lack data diversity, whether by race, sex, or other factors, and the lack of data diversity, quote, diminishes the generalizability of these studies and potentially of the tools developed using data, end quote. As the ACLU paper notes, there is no single agency regulating AI tools and clinical algorithms that are in use today, but instead, quote, a patchwork of regulatory powers has led to gaps in permitted and continued use of potentially harmful technologies without sufficient oversight, end quote. Experts such as Ashish Jha, previously the director of the Harvard Global Institute, believes that bias in algorithms is far easier to eradicate than human bias, and noted, and we're going to move on now to page 801, we're quoting Ashish Jha, algorithms that are built well with these issues taken into account can help doctors overcome subtle, unconscious biases they may have. Data and algorithms have a lot of potential to do good, but what this study reminds us of is that if you don't do it right, you have a lot of potential to do harm, end quote. Based on the foregoing and the recommendations listed in the ACLU paper, the task force recommends that the legislature provide state funding to the California Department of Public Health, a University of California or California State University center or department, or another appropriate entity to study the potential for harmful biases in commercial algorithms and AI-enabled medical devices, and, quote, evidence-based research into the use of devices and tools that recommend adjusting patients' treatment or medication based on broad racial categories in the absence of information on genetics or socio-cultural risk factors, end quote. This study should also include recommendations on how best to regulate commercial algorithms and medical artificial intelligence tools in California. The task force also recommends that the legislature require the California Department of Public Health to issue guidance to hospitals and other medical systems to ensure that commercial algorithms and AI-enabled medical devices, quote, are not used for clinical applications without FDA approval or clearance, are not used on patient populations they were not intended for, and that cleared tools are not used outside of their intended use cases, end quote. The task force further recommends that the legislature authorize the California Department of Public Health, quote, to make and maintain a public list of software as a medical device, SAMD, products, and provide demographic information about the subjects in which the devices were calibrated or trained, end quote. Finally, the task force recommends that the legislature allocate positions and funding to the California Department of Justice to pursue claims against algorithm and AI-enabled medical device manufacturers in these products if these products have disparate impact when providers use it in accordance to the manufacturer's instruction, or if the products misleadingly promise fairness. Next section. Fund and expand UC Prime Lead ABC programs to be available at all UC medical campuses. African American physicians and patients have experienced historic and ongoing discrimination in all aspects of healthcare system. After the end of the Civil War, federal, state, and local governments continued to deny African Americans adequate health care through numerous policies, including through the Hill-Burton Act, which funded the creation of the modern hospital infrastructure by funding segregated hospitals, including many throughout California. Even after the end of formal segregation policies, the government failed to address their lasting discriminatory effects. For instance, one news report suggests that Black resident physicians are disproportionately dismissed and reprimanded for transgressions that go unpunished for white resident physicians. And a number of Black physicians in California have brought lawsuits alleging that hospital systems in the state have enacted, quote, pervasive hostility against Black professionals and medical students, end quote. This discrimination against Black physicians has in turn reinforced discriminatory denial of adequate care for Black patients. While Black Californians make up approximately 6% of the state's population, only 3% of active patient care physicians in California are Black. And in 2021, in a 2021 to 2022 study, found that nearly 1 in 3 African Americans in California have been treated unfairly by health providers because of their race or ethnicity. To address inequities in healthcare and increase the number of African American physicians serving African American communities with special consideration for descendants, the task force recommends that the legislature provide funding to allow University of California permanently expand the UC Prime Lead ABC program, which includes a specialized curriculum, training experiences, and dedicated faculty mentorship to train and recruit physicians to serve in the programmatically defined, predominantly African, Black, or Caribbean ABC communities to be available on all UC medical campuses. To the extent that the UC Prime Lead ABC program does not currently give special consideration to those who are descendants of individuals enslaved in the United States, the task force recommends, and we are turning the page again, we on fire tonight, we're going on to page 802. So the task force recommends the legislature fund a special program to allow the University of California create an equivalent pathway program specifically for this group. And the task force recommends that the legislature include funding for the UC Prime Lead ABC programs to expand their mentorship and support services to include comprehensive mental health support, especially regarding racial stress and trauma, and that such mental health support services continue to be provided to participants after they complete the UC Prime Lead ABC program. Surveying existing literature on the effects of the UC Prime programs, one 2022 report found that the UC Prime programs added significant numbers of African Americans to the UC system's medical schools. From 1990 to 2019, the annual number of African American medical students in California rose from 63 to 121 students, with, quote, public medical schools accounting for most of this increase, end quote. Additionally, care by African American physicians can address the discriminatory treatment that African American patients might otherwise receive when seeking health care. In addition to increasing the number of African American medical professionals serving African American communities, the legislature should, 1, fund grants providing scholarships or loan forgiveness to African American medical students, physician assistants, and nurse practitioners who commit to serving African American communities. And 2, fund grants providing scholarships or loan forgiveness to medical students, physical assistants, and nurse practitioners who are descendants and who commit to serving predominantly African American communities. To the extent that the legislature implements a loan forgiveness program, eligibility for loan forgiveness programs should, at a minimum, include African American medical professionals serving African American communities through community-based organizations. Next section. Create and fund equivalents to the UC Prime Lead ABC programs for psychologists, licensed professional counselors, and licensed professional therapists. As described in Chapter 12, Mental and Physical Harm and Neglect, the historic and ongoing discriminatory health harms to descendants include inadequate access to mental health care, a harm compounded by the stress and trauma of ongoing racial discrimination experienced by African Americans in California, including descendants. To address unequal access to mental health care services, the task force recommends that the legislature create and fund equivalents to the UC Prime Lead ABC programs for recruiting and training psychologists, PhD and PsyD programs, and licensed professional counselors and therapists master's programs committed to serving predominantly African American communities with special consideration for descendants. The task force also recommends that funding of these programs include comprehensive mental health support, especially regarding racial stress and trauma, and that program participants continue to receive such mental health support services after students complete their program. Due to the ongoing disparities and discrimination in mental health care, experts have called for the state to expand funding for educational capacity, stipends, and scholarships to strengthen the size, distribution, and diversity of the mental health and behavioral health workforce. As noted above, the UC Prime programs present successful models for programs that both recruit and mentor African American medical professionals while also increasing the number of medical professionals dedicated to serving predominantly African American communities. While the state of California has enacted various measures to increase the overall supply of mental health professionals, these prior policies do not appear to involve any targeted effort to increase the number of African American or other professionals serving African American communities specifically. In addition to increasing the number of African American mental health professionals serving predominantly African American communities, the legislature should: one, fund grants providing scholarships or loan forgiveness to African American mental health professionals who commit to serving predominantly African American communities, and two, fund grants providing scholarships or loan forgiveness for mental health professionals who are descendants and who commit to serving predominantly African American communities. Sounds like specificity to me. To the extent that the legislature implements a loan forgiveness program, eligibility for loan forgiveness programs should, at a minimum, include African American mental health professionals serving African American communities through community-based organizations. Rolling on to page 803, section permanently fund the California Medicine Scholars Program and create a fund equivalent pathway programs for students in the CSU and the UC systems. Historic and ongoing discrimination against African Americans in California has produced a myriad of barriers throughout the pathway to becoming a healthcare provider, including financial barriers, lack of access to mentorship, lack of access to academic advising, and a dearth of opportunities to participate in academic and summer enrichment programs relating to science, technology, or medicine. To remedy the discrimination that has excluded African Americans in California from the field of medicine and denied African Americans in California equal and adequate health care, the task force also recommends that the legislature permanently fund the pathway initiatives in the California Medicine Scholars Program and create an equivalent pathway program for students in the CSU and UC systems. The California Medicine Scholars Program, CMSP, was created to connect community college students to medical schools, clinics, and medical practitioners to promote pathways for underrepresented college students to enter the field of medicine. Students from an eligible community can apply to the program, which partners them with a medical school in one of 4 nearby geographic regions. The program then provides mentorship by medical practitioners, academic advising, enhanced curriculum, and priority enrollment to that student when the student applies to that particular medical school. Several studies over the last 4 decades have found that participation in pathway programs improves the odds of medical school matriculation among students, including African American students from excluded backgrounds. In addition, the legislature should expand or create pathway programs like CMSP to 1, create similar pathway programs for high school students, yes, and 2, create a pathway program for other medical professions such as physician assistant and nurse practitioners, because, quote, literature that describes or evaluates nursing pathway programs, end quote, or pathways to other healthcare professionals, quote, is scarce. If the legislature, end quote, if the legislature expands the creation of funding of pathway programs to include other medical professionals such as nurses and physician assistants, the task force further recommends that the legislature fund an accompanying study of such pilot programs to ensure that the programs are equally effective in improving recruitment and retention of African Americans in other medical professions. Next section. Review and prevent racially biased disciplinary practices by the Medical Board of California. A report by the California State Library Research Bureau reviewing California Medical Board data from 2003 to 2013 found that African American physicians in California were more likely to be subject to complaints, and the board was more likely to investigate a complaint brought against an African American physician than a white physician. To remedy discrimination in physician discipline, the task force recommends legislation to review and prevent racially biased disciplinary practices by the California Medical Board. In its investigatory and disciplinary proceedings by implementing the following. 1, requiring the board to permanently staff and train its disciplinary demographic task force, which finds training opportunities to eliminate implicit bias and reviews the board's processes for such bias. 2, requiring the board to undergo implicit bias training. 3, requiring an annual third-party review of the board's investigatory and disciplinary records to determine racial disparities in its investigatory or disciplinary practices. That sounds like non-repetition to me. And 4, in the event that an annual review uncovers racial disparities in the board's investigatory or disciplinary practices, requiring the board to enact any other measures necessary to directly remedy any requiring the board to enact any other measures necessary to directly remedy any discriminatory actions taken by the board. For example, reinstating a license in the suspension process was affected by racial animus. Moving on to page 804, and we are going to the section Address Food Injustice. Black households disproportionately experience food insecurity. As discussed in Chapter 12, mental and physical harm and neglect, predominantly African American communities also disproportionately experience highly limited access to affordable, nutritious food and are often inundated with unhealthy options like sugary drinks and processed or fast food. High densities of liquor stores and tobacco shops in the communities also pose a public health concern because of their link with violent crime. The resulting health harms are stark. Redlining, bolstered by other government and government-enabled discrimination, is a central cause of this food injustice. In order to remedy these harms and to improve access to affordable, nutritious food, the task force recommends a slate of measures, including improving supermarket and grocery store access in African American communities, increasing the number of farmers markets and community gardens in these communities, supporting healthy food retailing and limiting liquor and tobacco stores, and funding Descendants and trusted community-based organizations to launch and sustain urban agriculture ventures, grocery stores and cooperatives, farmers markets, mobile food vending operations, and related infrastructure needed to bring food justice to African American communities with special consideration for African Americans who are descendants of persons enslaved in the United States. Improve supermarket access. One of the harms facing African American communities in California is the lack of access to grocery stores and supermarkets. White neighborhoods on average have 4 times as many supermarkets as predominantly African American neighborhoods, and grocery stores in African American communities typically are smaller and have less selection. There are a number of approaches the task force recommends to begin remediating this harm. First, to ensure a coordinated and continued response to these harms, the task force recommends that the legislature continue to fund the California Healthy Food Financing Initiative Council, which is tasked with expanding food access by developing finance options, partnering with state, local, nonprofit, and philanthropic programs and providing updates to the legislature. The Healthy Food Financing Initiative Council has supported regional food hubs in locations like hospitals, schools, and corner stores, where buyers can purchase local food at reasonable prices with reduced transactional costs. The council also assists food hubs to develop capital funds and conduct outreach to farmers. The council has also aimed to increase new grocery stores in underserved areas to increase access to healthy foods, lower food costs by facilitating access to funds and grants, and encourage local governments to speed approvals and permits. The additional aim has been to increase healthy food sold at current stores by assisting stores with access to funds and connecting them with technical assistance with sourcing, storage, store design, and marketing assistance. In addition to recommending the continuation of the council's funding, the task force recommends that the legislature amend the council's mission to include an explicit provision for a committee focused on the needs of the African American community. Second, the task force recommends that the legislature provide economic or other incentives to support the development of supermarkets in African American communities that lack adequate access. These incentives may include tax breaks and grants to support nonprofit grocery cooperatives. Third, to implement the development process for such stores, the legislature should also facilitate the adoption of zoning laws to support the siting of supermarkets in underserved African American communities. In conjunction with the above, the task force also recommends that the legislature study the continuing impacts of restrictive zoning laws and the California Environmental Quality Act, CEQA, process on the development of new grocery outlets in underserved African American communities for the purpose of identifying and adopting additional measures needed to remove remaining barriers to siting grocery stores in these communities. Fourth, in order to remedy the harms from abrupt disruptions in access to food, the task force recommends that the legislature consider requiring advance notifications to the affected community, employees, and other stakeholders prior to the closure of a grocery store in underserved or at-risk African American communities. Such notice should be meaningful and adequate for the circumstances and include informing the California Department of Social Services and local entities of a planned closure, and should also include the identification of the 3 nearest grocery establishments that provide comparable service. The legislature should also consider requiring county human service departments to provide grocery establishments that have announced a closure with information about public social services for which employees may be eligible. Moving on to the top of page 805. Additionally, cities should be required to monitor grocery store closures to access potential trends. Fifth, to the extent that regulations and contracting provisions are at fault for the lack of grocery stores in African American communities, the task force recommends that the legislature prohibit covenants and lease provisions that prevent the operation of grocery stores in these communities. Finally, as discussed in Chapter 7, racism in environment and infrastructure, African American communities often have fewer and worse public transit options. In order to remedy this harm, the task force recommends that the legislature tie a portion of funding for local governments to the planning and implementation of public transportation routes and schedules that maximize access to supermarkets in African American communities. Support and expand farmers markets and community gardens. As discussed in Chapter 12, Mental and physical harm and neglect. African Americans in California are more likely to live in areas without access to full service grocery stores and areas in which residents have few or no convenient means of securing affordable, healthy foods like fresh fruits and vegetables. In addition to increasing access to full service grocery stores, increasing access to farmers markets and community gardens can help remedy the harms faced by African American communities. Thus, the task force recommends the following actions in order to increase access to farmers markets and community gardens offering organic whole foods in African American communities. Formerly redlined neighborhoods and other neighborhoods that are home to African American families lacking adequate access. First, with regard to farmers markets, the task force recommends that the legislature use requirements for zoning laws and land use policies to create and encourage localities to create new space for farmers markets in African American communities. Additionally, the task force recommends that legislature provide government subsidies to create public-private partnerships to develop new farmers markets in these areas and provide financial support for the marketing of such markets in the community. Moreover, given the transit issue discussed in Chapter 7, racism in environment and infrastructure, and to ensure access to such markets, the task force recommends that the legislature provide financial support for transportation to farmers markets and increase incentives for local transit agencies to ensure their routes includes access to farmers markets from African American communities. Finally, given the economic hardships discussed in Chapter 13, the wealth gap, the task force recommends the legislature continue to encourage and, where possible, require farmer markets to accept electronic benefits from food assistance programs such as the Special Supplemental Nutrition Program for Women, Infants, and Children, WIC, and Supplemental Nutrition Assistance Program, SNAP. Second, given the potential of community gardens and urban farming to help remedy the food access issues described above and to help furnish fresh produce to African American communities, the task force recommends that the legislature promote community gardens and urban gardens in these communities through zoning policy and grants or other financial support. In addition to encouraging local municipalities to change zoning policies to promote such spaces. Third, the task force recommends that the legislature increase farm to school and farm to institution programs in African American communities and develop government procurement processes that specifically support local African American farmers in regards to these programs. All right, y'all, we did it. We at the last page, page 806. Let's go. Enhance healthy food retailing and curtail the proliferation of unhealthy food retailing. As discussed in Chapter 12, Mental and Physical Harm and Neglect, African American communities have an over-concentration of liquor stores and tobacco stores, which are correlated with health problems for African Americans. Moreover, African American communities are specifically targeted by marketing agencies for sugar-sweetened beverages. For example, Black children and teens are more than twice as many, teens see more than twice as many ads for certain sugar drinks than their white peers. And lower income Black neighborhoods have disproportionately more sugary drink ads on billboards, bus benches, sidewalk signs, murals, and store window posters. And sugar has had disproportionate negative consequences for African Americans as it is linked to diabetes and hypertension. To remedy these harms, the task force recommends proposals aimed at limiting certain stores in African American communities, encouraging more fresh produce and other health foods at existing stores, and encouraging the increase of other informal methods of healthy food deliveries in these communities. First, the task force recommends that the legislature enact standards that will lead to local zoning restrictions, limiting the number of liquor stores and tobacco shops per neighborhood in African American communities. In conjunction with this, the task force recommends that the legislature support or require the enactment of zoning laws that create buffer zones, restricting liquor stores and tobacco shops around schools and recreation areas in these communities. Second, the task force recommends that the legislature offer financial incentives such as reduced taxes and fees to encourage small store owners in African American communities to offer fresh produce and healthier foods. In conjunction with this, the task force recommends that the legislature incentivize restaurants in African American communities to reformulate menu items to provide healthier options. Third, in order to increase the availability of fresh produce and counter the prevalence of sugary beverages, the task force recommends that the legislature enact legislation to facilitate the provision of permits and incentives to healthy mobile vending carts in African American communities. To help to effectuate a healthy food environment, the task force also proposes that the legislature require the California Healthy Food Finance Initiative Council to assess further opportunities for innovation and partnerships to increase access to affordable, nutritious food and to reduce the saturation of liquor stores and tobacco shops in African American communities. As part of this work, the task force recommends that the legislature require the council to support the development and ongoing work of local food policy councils, which bring together stakeholders to assess how food systems operate at the local level and formulate recommendations for improvements. Informally redlined communities and predominantly African American communities with limited access to affordable, healthy food. Additionally, the task force recommends that the legislature amend the Food and Agricultural Code to establish legislative findings and declarations regarding the importance of reasonable access to nutritious food for African American communities as a measure to support other efforts going forward. Finally, the task force recommends that the legislature fund community education in African American communities regarding nutrition, health, and resources available to access affordable, nutritious food. Bringing nutrition and economic opportunity to communities. As noted in Chapter 12, Mental and Physical Harm and Neglect, African American communities suffer specific harms in relation to food injustice. Moreover, as discussed in Chapter 10, Stolen Labor and Hindered Opportunity, African Americans have suffered economic harms and been denied fair wages and labor opportunities. In order to address both these areas of harm, the task force recommends that the legislature create and fund a program of grants, low interest loans, and technical assistance as needed for trusted community-based organizations in historically African American communities, formerly redlined neighborhoods, or similar neighborhoods which are home to African Americans who lack adequate and equitable access to affordable, nutritious food options. These grants and low interest loans would be used to support the creation and ongoing growth and stability of urban agriculture ventures, grocery stores and cooperatives, farmers markets, mobile food vendors, and related infrastructure needed to bring about food justice and stimulate pipelines for healthy, whole foods. While focused on increasing access to nutrition, and improved health outcomes. This program of grants and low interest loans would bring added economic development and employment opportunities and provide some measure of redress for the long history of discrimination against African American farmers and small business owners, especially those who are descendants of an individual enslaved in the United States, in communities that continue to suffer consequences in redlining and other forms of discrimination. All right, y'all. That was chapter 29. And need to find my little sign off paperwork. Give me 1 second. That concludes our reading. We actually got through it with 5 minutes to spare. So chapter 29, we close that chapter out here tonight. Mental and physical harm and neglect. Before you go, if you haven't done so already, don't forget to 1, like this video, 2, hit the bell for reminders, and 3, subscribe to our YouTube channel. When you go, don't forget to connect with us. Follow CJEC on social media, Instagram, TikTok, Facebook, and Twitter at CJEC Official. Get informed. Visit www.cjec-official.org and sign up for current and accurate California reparations news and information on our Get Involved page. Get involved, support our work by volunteering and or donating. To donate, again, just click the donate tab on the homepage of our website. Special thanks to our amazing fiscal sponsor, the California Black Women's Health Project. Thank you, Kim, for helping produce tonight from ETM Media. Thank you all so much for your time. I appreciate you. We are closer to reparations than we have ever been. Peace and reparations, fam.